Welcome to Senior Connection Center. In the next few minutes, we'll be acquainting you with our organization and explain how we connect seniors, as well as persons with disabilities and their caregivers, to the programs and services they need. Most people reach the Senior Connection Center by calling our Elder Helpline.
I am the first point of contact for any individual who is in need of assistance in the community. Generally someone who is in need of help with transportation or housing or food, whatever help that they may need. We try to get them connected with whatever resources in the community that can help them.
The essence of the Elder Helpline is to empower people to obtain their resources.
Our highly trained staff utilize the most up-to-date technology, along with their knowledge and experience, to direct people to the most affordable and appropriate services available.
Yes, so here at the Elder Helpline, we use a database called Refer, and that's where our Elder Helpline specialists search for information to give to the callers. And we are continuously working on updating these resources to make sure we are giving valid information to the callers.
Most older Americans receive Medicare health insurance benefits, but navigating the maze of Medicare can be overwhelming for anyone. Our Shine volunteers are here to help seniors and their caregivers by providing unbiased information and counseling them to understand the ins and outs of Medicare.
The Shine volunteer was excellent. He helped me out with choosing a program, a Medicare program, and since he had all the resources to do that, it made it very easy for me.
As the Shine Liaison and Volunteer Manager here at the Senior Connection Center, I am continuously awestruck by the incredible volunteers on our team. In 2016, Shine volunteers spent a combined total of more than 8,481 hours assisting people with their Medicare concerns across over 25,000 counseling sessions. This includes providing help to more than 6,000 disabled individuals, 13,000 low-income individuals, and over 10,000 persons over the age of 75.
At Senior Connection Center, we believe that one of the best ways to help seniors maintain their independence and dignity is to help them get healthy and stay healthy. We offer many evidence-based health and wellness programs throughout the communities we serve, including fall prevention and Tai Chi classes, as well as chronic disease self-management classes, most of which are taught by trained volunteer lay leaders within their own communities, like Artie Fryer.
I grew up here in Tampa, but I grew up in East Tampa. Didn't know much about the program, but because it was specifically designed for that, then I was interested. I'm also now involved with health-related issues in my employment. So that began first. Again, getting more aware of health issues, being more health conscious, and then seeing that this was a program that was going to be conducted in East Tampa. Those kind of things sort of just lined up for me. I saw that there was a need for lay leaders. That was the area that I was interested in, which meant then that lay leaders, as I got more information, it was the lay leaders who would act as facilitators for the class. As a part of that whole process, I found we had to go through a session that actually took us through the entire curriculum in training.
As Artie went through the lay leader training, he realized he could apply what he was learning to improve his own health as well.
I'm diabetic, have been for some time. And my doctor even said, he asked me point blankly, or he made the comment, he said, "You're really not taking this seriously, are you?" And I wasn't. And as part of this whole self-management, chronic disease self-management program, it helped me to understand that there are things that I can do and I should do. But as I just mentioned to you, it's a matter of me making the conscious decision to be more serious about my health. Ask yourself, is your health really important to you? First of all, I think that's the honest question. Because if the answer is yes, then the attendance to the workshops for 6 weeks won't seem to be a burden. It'll seem to be an investment. I would also say that the course provides some valuable information, some food for thought, things that will benefit your health or the health of a person that you are concerned about, because that was also one of the things. It was either you, the individual, have a health issue, or you are a caregiver to someone. And I've come to believe, as the longer I live, a motivation for many of us is not always for ourselves. If we can do something for someone else.
Another way we serve older adults and persons with disabilities is through our management of the Veterans-Directed Home and Community-Based Service Program. Pat Colbert is just one of our veteran clients.
I am a Desert Storm veteran. I worked in Arizona and Europe, briefing generals, and I worked under General Colin Powell. I worked in the S3 shop, where I was required to brief him and talk about the tactical intel mission and work with him when he came to the field to see what we were doing with our assets in the field.
Pat was involved in a car crash that changed her life.
On one of my trips to Gainesville, I was in a car accident. A teenager was coming north and I was going south, and we did not have a head-on collision because I swerved, according to police, to keep from hitting her head-on. And I sustained an open compound fracture to my ankle. My tibia and fibula were broken. My back was injured, and that started to spiral downhill. And I would have a surgery every year for 8 years.
This program allows disabled veterans the flexibility to choose and manage much of their home health care needs, including hiring their own caregivers, who are oftentimes family members or close friends.
Initially, I just was a friend who was helping someone else who needed it. And that went on for 12 years until probably January of 2016, when we entered this Veterans Directed Care program. Pat had to medically retire, and she was going through those home health agencies year after year with the VA, and they just were not able to be flexible enough to meet her needs. She was not the typical elderly patient. She had been injured in her 40s. So once we entered the program, I was able to come on as her caretaker in a paid capacity, but more so than just me. Then she was able to get physical therapy included and housekeeping included, so that she wasn't confined to the home. She could go out, she could stay active, and it seems to really have worked out.
What the Veterans Directed program did was it allowed me to get back out in the community. I can go visit my children, and I couldn't take a home health aide person with me, but Erica, my power of attorney and my healthcare surrogate, she goes with me. So she rides the plane with me. She's there to help me bathe and do all of those things. I can go visit friends in Tallahassee. I go to Disney. And when I'm feeling well, I live, quote unquote, a normal quality of life as much as I can do. I volunteer to tutor a student who's autistic, and Erica works and goes with me to the family when I'm too sick to drive. She takes me there. So it was a long road until I got into the program. But when I got into the program, it was a breath of fresh air. My life changed tremendously. This has saved my life. This program has saved my life.
As you can see, Senior Connection Center plays many critical roles in our community. We simplify and streamline information for those who are unsure about where to turn for help. We empower individuals with knowledge and information to make sound decisions. We motivate and educate people to improve and maintain their health, and we assist disabled veterans to manage their personal health care services. Our mission to help older adults and persons with disabilities live with independence and dignity guides us in everything we do. We hope you'll help us further our mission by referring someone to our Elder Helpline, joining our team of volunteers, or making a donation to Senior Connection Center today.